Hey guys, it's Wasa from Eye Care Pharmacy. You'll notice this pristine, beautiful beach behind me. I thought it was really fitting considering how much snow we've gotten over the last 48 hours. So yeah, I guess it's official. We are getting a winter. I mean, we've been really lucky. We didn't have any snow even on Halloween, and that's a rarity, right? And that I was so grateful for that because we got to take our little one, got to take Atlas on his first trick or treat, and he didn't have any snow. We had a great time. We hit like only just like a dozen houses. I'm not really even sure he understood what was going on, but he had a blast. So yeah, it was lots of fun. So I just wanted to talk to you about RSV. RSV is respiratory, and I'm going to butcher this middle word. I always have trouble with it. Respiratory syncytial. Yeah, that's it. Respiratory syncytial virus. Ooh, got it right. I practiced it off camera so much. RSV, RSV. So, you probably read in the news, probably heard from your friends. RSV is kind of making a big surge this winter. So, what is RSV? RSV is actually just a common virus. It's something that's been around for a while, so nothing new. What is new is that maybe because we had the broad lifting of mandates all at once, or maybe it's because of all these pandemic babies. Like for instance, Alice, he's a pandemic baby, so he did not have any. He did not have any exposure to like the common cold or viruses like the RSV, just because there were a lot of restrictions in place, so there was a lot less socialization at the beginning. But now that he's in daycare, there's a lot more socialization happening. He's more at risk. So, and a lot of kids are in this boat, and because of that, RSV is making a comeback this year. So a lot of kids, they're having trouble with labored breathing, and we're going to talk a little bit more about that. But it's a serious thing, right? It's the things that are putting the kids in the stollery, and this winter so far have been RSV, COVID, and the flu. So if you haven't got your flu shot, get your flu shot. If you're not updated with your COVID, get your COVID shot. If you're 12 and up, you can get the bivalent COVID as well for 12 and up. So that's the new COVID shot that protects you against Omicron. So those are all little things that you can do to kind of help out. So normally RSV is pretty mild, especially in adults, right? And maybe not so much in older adults, but in general healthy adults, it's pretty mild. But for kids, it's a problem. It's a problem because you get all this mucus production, and the kids can't clear it. They can't. They don't really have the ability to sneeze it out. They don't really have cough it out. They're small little guys, so they can't really do what they need to do to kind of clear it from their bodies so they can breathe easier. So that's part of the problem. I had a family who, another family that I talked to, the whole family had RSV, and that's what they were having trouble with. They couldn't clear it, and excuse me, eventually it progressed to bronchitis and progressed to pneumonia. So we can get some complications with this. So let's talk a little bit about what you can do to kind of help your kids keep safe, minimize their risk of getting RSV. So you want to do frequent hand washing. These are all behaviors that you learned during COVID, but just to reiterate them, frequent hand washing, keep the kids well hydrated. Hard to do, hard to teach a kid to do this, but keep your hands away from your face, and also frequent disinfecting of surfaces. Now, here's a secret. My family got RSV as well. And Atlas got it, Doreen got it, and I got it. And I really wanted to talk about this because it really illustrates what you should do during a RSV infection and how different people react quite differently, and how that should take kind of change your approach in order to be able to know what to do and to minimize the risk of RSV, and also if you do get RSV. So for Alice in particular, he was having trouble with fevers. His fever was like 40 degrees, sometimes a little above 40 degrees. So that was scary. Also, as well, lots of mucus production, a cough like you wouldn't believe. It sounds like there was another adult in the room. He was coughing up a storm. And that's just lots of mucus production. Like when he would breathe, you could hear how mucousy he was. So the things that we did for him is we for the mucus we use Salinex, so nasal saline drops. Also, as well, we'd use a steam bath. So we'd run in the shower, get the steam in there, throw them in the bathroom for a bit, so we can kind of get all that moisturization in his sinus cavities there. Also, as well, run a humidifier. So that really helped a lot too. And so the idea is there is just to help to kind of break everything up so he can clear it. In regards to his fever, that's a difficult situation, especially when you get, 40 degrees. It's not going to be enough just to do the Tylenol and Advil. So we're rotating between Tylenol and Advil, but also as well lukewarm baths to kind of help bring the temperature down. Tylenol and Advil works better if you can get the body temperature below 38 degrees. So so using Tylenol and Advil, just by themselves for a fever that's above 38 degrees might not always be effective. That's why sometimes you need that lukewarm bath. That's what we kind of did with him. That worked well. I know there's a shortage on Tylenol and Advil, and we've seen a huge spike in demand for Tylenol and Advil over the last week. We have lots of patients calling us asking, hey, what can we do? Just to remind you, we do have compounded forms of Tylenol and Advil, so those are available. You do have options that are available to you if you do need it for your little one there. So Doreen also got the RSV. Her, it was really bad as well. So Atlas was gone for about a week. Doreen has been out for about a week. Again, like lots of mucus production, big cough, fever. She wasn't doing so well. Now here's a tricky thing. I got RSV, and I might sound a little nasally now. I'm having trouble saying the word Tylenol because I have just so much stuffiness up here. But to me, it presented as a cold. It was just a mild cold, not even a bad cold, a mild cold. Lasted a few days, and then I was okay. Like it's bearable, right? It's nothing bad. So that's the tricky part with RSV, right? Where you want to keep your kids away from adults like me who have had, are just getting just recovering from like a minor cold or something like that, or at least have them mask up, right? Because the issue is, although it's mild and minor in me, for your kid, it can definitely be something more serious. So that's kind of the number one thing, right? If you have an adult who's just recovering from like a little bit of a cold, it might be best to, not have your kids necessarily interact with that adult until they feel better. So that's probably the number one tip because it's a little tricky. So it's something to kind of bear in mind there. And because like we talked about earlier, the biggest problem with RSV is that mucus production, which can lead to kind of labored breathing. So we want to help to try to minimize that. And those are all things that you can do to kind of help make sure your child doesn't get RSV, or if you do, help manage the symptoms. If they do get labored breathing, you want to get them checked out from your pediatrician, or if it's something really, really serious, get them checked out by the stollery. It's better to be safe than sorry. So I've definitely taken the stollery if they are having a lot of trouble with breathing. Anyways, that's all for me. Thanks for listening, guys. Take care. Have a great weekend. Bye.